Hello, everyone. Thank you so much for opening. My name is Ryan Tuminima. If you're a returning subscriber, thank you so much for helping in. If you're new, my name is Ryan Tuminima. I'm a math student studying medical radiography at Federal University of Technology, School of Basic Medicine in Imo State, Nigeria to be precise. And apart from my studies, I'm also a proficient freelance medical writer. So I write a lot of medical articles, medical blog contents, medical educational materials for a couple of um, companies I work with and a couple of personal clients I work with. And I also write social media content as well. So today I have an amazing personality. She's a pharmacist all the way from the United States of America. Hey, Freeman, could you introduce yourself to the audience?
Hello, all. Thank you for joining us. I'm Dr. Ahunna Freeman. I am a pharmacist. I'm also a pharmacy owner and a pharmacy consultant for healthcare providers that work in outpatient practices here in my city, in Winston-Salem, North Carolina. Thank you for
Hmm,
having me, Ransom.
amazing. So even looking down words, I'm reading the questions to Dr. Freeman to answer. All right. So you guys been wondering what rise I'm looking downwards for. So thank you so much for introducing yourself, Dr. Freeman. So the first question for you goes this
Mhm.
way. Hmm, like you said, you own a pharmacy, right?
I do, yes.
That's really amazing. So, as a pharmacy owner, right, what are the key strategies, you use to ensure patient safety and medications compliance? So tell us.
Um, One of the things I do, and I think that's why I chose the route of ownership, is to be able to build long-lasting and solid relationship with my patients and my community. So one strategy that I use is building relationships, and with that, I'm able to earn their trust, and I'm able to learn exactly who these people are, and not just being a face that has the medication expertise for them. So I try to relate with them and more on a human level too than just their pharmacist. So building the trust allows me to greatly educate them on medications, medication use, safety use of those, their medical condition. These are some of the strategies that I use: patient education, relationship building.
And thank you so much for sharing your narrative in that way. There are some patients that are not easygoing, right?
Mhm.
To attend to, because I'm doing my clinical rotations currently at Everett Diagnostics here in Imo State. So I've met a lot of patients that are not easy to go along with. So how do you intend to roll with all those patients that are really hard to get into in terms of building relationships?
Well, I always believe that there's a reason why anyone, not just even a patient, that you're attempting to build a relationship with has that wall. And it could be because of past experience they've had, or it could be because of current experience that they're having. And honestly, those patients or those people are the ones that we have to slow down our moves to really get to see the origin of why it's difficult to build that relationship with them. And
Hmm.
believe it or not, for the most part, people do appreciate when somebody is able to slow down for them and meet them where they are. Even as a human, you are a medical student, as a student, a medical in medicine, or no matter what profession in pharmacy school, a pharmacist, everyone likes to be heard, So taking the time to listen to someone can make a big difference on how they react to whatever you're trying to do with them. So that's when
Amazing.
those when it gets to that's how I approach that, slowing down and trying to find out the foundation or where that's coming from.
Amazing. And that was an amazing narrative in there on that question I asked you. So,
Mm.
the second question goes this way. Can you share your views, your own perspectives on how pharmacy consultants can support community health professionals in improving patient outcomes and managing medical related health issues? So tell me, what is your perspective on that question?
Yeah, right. My personal perspective on that, some may not agree so much on because we've always been taught to just hone down and do our own thing and keep going on our own. But the truth is, how I feel about that's how consulting or consultants can make an impact on community health is being able to break outside of our little wall and our little box that we work in. And instead of just focusing on what we're doing with just the patient, we also have to focus on who else is influencing the patient that we're working with, that trying to build the a good health outcome with, right? And that means networking and involving ourselves with other professions outside of our own, because what we gain from that is we understand how those other professions operate, and then in the same token they understand how we operate, because at the end of the day we're all on the same team. Technically I'm working with this patient, they're working with that patient, we're all working connected through that one patient. So being able to break down our wall and make connections with the other side of our profession is the best way for me to have more impact in community health.
I want to make this clear. I think there's a little confusion somewhere. The viewers might think, what is the difference between pharmacist and pharmacy consultant? So could you clear the differences?
Yes. So between pharmacy and pharmacist consultant. Is that right? So as a pharmacy, as a pharmacist in a pharmacy, you're really just involved with the medication management of the patient in your pharmacy, right? But as a consultant, sometimes you may be involved with not only the medication management of the patients in your pharmacy, you're consulting with other personalities or other professions that may need clarity or may need insights about pharmacy to help them help their own patients. And
Mm,
sometimes it might be other pharmacists looking for insights on what you're doing in your own pharmacy to help them help their own patients. So that's the consulting part of it.
mm,
Is that
mm.
clear?
Yeah, thank you for the clarity, Dr. Freeman. So that draws me to the third question.
Yeah.
So, um, what new technologies or services have you used to improve patient experience and outcomes in your pharmacy?
Hmm. That's a good one. I think definitely one of the new things that I do often now that I used to not do when I first became a pharmacist is definitely using social media. There's power in social media. And when social media first came out, it had um, a negative vibe with it because professionals, why would you be on social media? Why should you be on social media? Imagine your patient looking you up on social media to see what you're doing. But social media, we've really started utilizing it a lot. in our profession. I mean, personally too, and I use it as a platform to also reach more people that are outside of my reach in the community. So I use it for patient education. I use it to bring insights on the industry happenings. Um, Other ways is just using new technologies that come out, um, that's compatible with our pharmacy software that we already use to do medication management with our patient. So some of those software allows us to send text messages because in this day and age, most people are tied to their phone. It's easier for them to just look up things, answer to it, than calling on the phone or having conversations. So that's one. That's another way. New technologies, social media, and um, yeah, pretty much. I think that's one of the two newest ones that we use a lot.
So what do you have to say about all the pharmacists like you that are into social media right now?
So, well, what advice do I have for them?
Yeah.
Oh, okay. Well, my advice to them is I understand how they would choose not to be on social media, but my advice to them is to give it a chance, give it a try, and understand that, especially if they're trying to reach more people and make more impact. Otherwise, those people and those patients that you're really trying to save might get the information from a non-reputable source, and they'll believe that those things that they're receiving are the truth. I mean, I'm not saying that a lot of influencers out there are not well knowledge on what they're talking about, but nothing trumps someone that is really invested a lot of time into learning something, gaining that knowledge, and sharing it. So that's how they can share their knowledge so more people can make good use of it. And at first, they really shouldn't worry so much about how it comes off because it's 2024 and I mean, it's only going to get worse. It's going to get better, the social
Hmm.
media life.
So before I move to the fourth question, do you think that you've made an impact through social media platforms?
Yes, they
What
can
way?
be it can be a positive impact through social media, and that's what I would like these a pharmacist that's not so into social media to be. In what way? Because the impact could come from the education piece that you deliver on your social media can really reach someone that you didn't even know that needed it at the time. It could be a granddaughter that is always on their social media and comes across your content, listens to it, use it, reads it, and then when grandma is having some type of crisis, maybe grandma's one side of the face is a little slurred, and she remembers, I think I saw that as a sign of stroke. Otherwise, where else? And that was something they mistakenly stumbled upon just because you put that content on social media and they stumbled upon it. Now they've saved somebody's life. And that's a good impact. That's the impact you want.
Hmm. Hmm. That's amazing, Dr. Freeman. Thank you so much for sharing narratives on those questions. And I believe that the audience greatly adore you for your perspective on those questions asked thus far. So the fourth question goes this way. Um, you've been drinking a lot of water. I think you're hungry or something because it's your lunch.
It's my lunchtime, but I always drink water anyway.
Alright, so the fourth question goes this way. So in today's healthcare environment, right, do you think you can navigate the complexities, of in terms of insurance, and advocate for affordable medicine on behalf of the patient? So before, let me clarify this. There are some complexities in terms of insurance. I don't know how it works in, in your country, America. So, but in Nigeria, it's you know a lot of complexities in terms of insurance, and there are some, pharmacy is really expensive to get drugs right now,
Yeah.
but they can't really afford, those drugs, right? So tell me, how can you advocate for affordability, of medicines or drugs on behalf of the patient or your patients right now? So tell us.
Well, that's a tough one because I always say it, dealing with the insurance is just a headache. But the truth is, um, it's there. We have to face it. So we might as well come with the gloves on, right? So, how can I help patients navigate through, or how can I advocate for your patients to navigate through this healthcare system, especially with costly medication, to be able to afford it to take care of themselves? Well, first thing first, whether they have insurance or not, it helps to understand what your priority is. So, if you have many medical conditions that you're trying to manage at the same time, which generates a whole list of medications that you have to take or have to be on or have to purchase, and it gets costly, it's okay to shop around. You have to look at your priorities and look at the options that match those priorities and go from there. And honestly, sometimes it requires the help of an expert in healthcare, somebody that is trusted. It could be their own pharmacist, or it could be someone in their family that they really truly trust, because it may come down to, this is what I think you should go with first. And then we can slowly find a way to get to the other list. So prioritizing which condition to manage first or to consider as on the top list is one. Shopping around so you can know what your options are. Could you buy half of certain medications, or could you use discount card on some, or like, what are my options? All right. So looking at those options before they totally give up, because it gets really complex. And when it's a lot complexity involved, it's easier to just say, forget it. I guess I'm just gonna die or whatever. Like, I mean, I have patients like that, and it's heartbreaking to see that. So I think the best way that I advocate for these patients, and I try to encourage them to find ways to go through this system, this complex system, is being able to know what their priorities are as far as their health goes, and then really look at what options they have around them, the resources available. Ask people, you know, ask questions, because their help.
Mm, wow. So we have two more questions for you to round up, you know,
Sure.
the
Go ahead,
session. But
Ryan.
yeah, before I move forward, could you tell us the difference between pharmacists and pharmacologists? Jeffrey, could you tell us more about the difference?
Well, here in the US, we don't really have pharmacologists. So I don't know if there's something in Nigeria. I'm Nigerian, but I didn't, and I grew up in Nigeria, but I didn't do studies there. So I have no idea if that's something that, as a graduate study, that exists back home. But I can tell you what pharmacists are, and I think it's universal, because here, for my pharmacist degree, Doctor of Pharmacy, we really went through a lot of pharmacology, and we became experts in pharmacology. But the pharmacist training involves pharmacology and a whole lot of other farm related stuff, pharmacotherapeutics, pharmacodynamics, like all of that. So it's all bulked up in one, to be able to provide patient care and understand how medications work, and understand how medications affect the body, and how the body affects the response you get from the medication, how the body affects the medication. Right. and how environments too affect how you respond to medications.
Mm.
So
I asked that question in my third year, first semester. We did a course named pharmacology. You know,
right,
we were taught about mostly about drugs and its response to the system, the bodily system. So I just what I did on that course really made me to ask that questions, because literally pharmacists they do learn about things about pharmacology. They do
right,
pharmacology as a course in Nigeria because I've had a guest speaker who was a first class, student in pharmacology here in Nigeria. So we do it as a course, but it's not that rampant as pharmacy, So,
yeah,
but pharmacologists, I think pharmacologists is separate from pharmacy. They're not together. Like radiography and radiology. I'm doing radiography, and radiology is really different from
yes,
radiography. So, but in a nutshell, just say it in a layman's understanding, radiologists are the doctorate aspect of radiography. Radiographers are not medical doctors. We are just radiation scientists. So if you want to like furthermore is when you're gonna do, you know, become a radiologist. So radiographers are those people that just take images from the patient and you know the internal bodily system of the patient using X-rays and some radiation equipment to get the necessary things needed from the patients, and that those that report the images are the radiologists. So we use the reporting system from the radiologist to send across to the physicians to interpret to the patient. So it's just like pharmacology and pharmacy as well. So you know, thank you so much for sharing that.
it's okay.
So the fifth question goes this way: in your experience thus far, what are the common misconceptions among patients regarding medication therapy? Tell us.
Uh, well, it's definitely involved patients' concepts. I tell you that, especially since COVID. The trust in the pharmaceutical world is. But the biggest misconception that I get a lot is, you know, um, the medication can really do more harm than help. I get that a lot, but I also have to, and again, that's why I feel like the public patients should seriously have the opportunity and the luxury to hear from professionals online too, to be able to debunk the myth and stuff like that. Because the truth is, yes, medications can harm someone, but the 100% honest truth is, it's not always the case. If it's used appropriately, it actually has more benefit than harm. There's no medication out there. There's nothing out there that does not have a side effect, unless water. Even water might have a side effect. I don't know. So that's one of the misconceptions that medications, it's really bad. It has side effect. It has too many side effects. But the way I correct that is everyone responds differently from from different medications. So there are different responses to expect. Not because Joe over there responded that way means that Angela would respond the same way. They're two different people and they're expected to have different responses. So, keeping that in mind, it's always best to start low, go slow, keep the least effective dose than trying to use all at one time, use multiple things at one time, and max it without a good way of slowly titrating to the right dose.
Mm,
So
mm,
that concept of medications are bad they're so harmful. I'm a pharmacist and I can tell you all about the medication if you really want to know about the medication rather than having a general blankets. It can save your life and it can also hurt your life.
Mm. I'll also add something. Self medication is also dangerous on a patient. I'll tell you a story. Last week me and my colleagues, because I'm in final level, so we're doing our clinical posting,
Mm,
so a whole lot of applications, and I was accepted in various places I applied for, but I chose this one because it was a bit nearer to my house, my father's house.
right.
So I have a patient, you know, normally in that hospital setting, we, the IT students, are the ones, doing all the images and stuff. The senior radiographers and chief radiographers are just there to just, navigate and see if there's any mistakes. So we had a patient. I think he had an accident, that injured. He had a fracture on the femur. So
Mm,
so femur is really fragile sometimes, but it's really very thick. So the fracture he had on the femur made the thickness of the femur to be more fragile. So instead of him to come over to the radiology room to take some images to see what really happened the you know on the femur he had accident on, he preferred they taking some herbal drugs and self therapy. Using traditional medicine is really, you know amazing sometimes. But there's time for everything.
there's a
I've
time for everything, yes.
I've had a guest speaker from the UK. She's an Indian British. She studied homeopathy in India before moving over to do a master's in public health. So she talked about how traditional medicine is really more, relevant in the UK right now. So
Mhm. Mm,
he chose to use the traditional and herbal way, Nigeria and the herbal stuff, But I'm not saying against them, but I don't really trust them, right? In some ways. So he started taking all this medication that made it more fragile. It really destructed some, you know, ligaments on the femur, which made taking the images to be more difficult for us. But in summary, we try our best to take the images, and we warned him that he should do the needful. You know, if you want to see the doctor, go see the doctor. If you want to see the radiographer, go see the radiographer. You don't do something because you just heard or everybody can one person can't know everything. So that's just like a disclaimer out there. You should always follow your professionals. If you have a headache, do well to because I did pharmacology and we did a lot of incitations on paracetamol, panadol, and their side effects. Their
mm,
side dangers that you need to see a professional so you won't take
yeah.
overdose. People think taking overdose is like your doctor told you to take two, you took three. No. Also, taking drugs without doctor's permission or prescription is also overdose of the drug taking. So,
Mm,
thank you so much, Dr. Freeman. So,
yeah.
the last question for you. Are you ready?
Go ahead.
Okay. As a pharmacy owner and also a consultant, how do you collaborate with other healthcare providers like radiographers, radiologists, ophthalmologists, gynecologists, other healthcare providers to promote collaborative, care and improve patient health outcomes, such as
Well, um, a collaborative way of doing things is there are many ways. There's an official way, and then there's the unofficial way. Um, Most of the time, the official way, well, all the time, at least here in North Carolina, the official way is really having it written down in paper, but it's only with a physician. And that way, with that, the pharmacist is able to do what her, him, and the physician agreed upon, for the patient care. And the patient has to be a patient of the physician. So it's not just any random patient that comes to you, then you flex your power to help them. No. So it's not that. So that's the only official way that works. But then the unofficial way too is being able to have someone that you can always call on or reach out to if you're needing some clarity on anything that's beyond the scope of your practice. So for me, if I have a patient with ophthalmology problems or um, some radiology problems or even pediatric problem, dentistry problem, whatever, dental issue, whatnot, like having someone I can reach out to, just a little more insight so I can help the patient would be nice. And that's actually what I offer in my own consulting practice for other providers, because a lot of times there needs to be a type of understanding on how certain things work that's outside your own professional scope, and knowing those information helps on how you manage your own patients or how you have a better outcome with your own patient. And that's a program I do on my consulting with like my pharmacist, having providers reach out to me as their trusted source and being able to really give them the insights and the true information, whether it's clinical or non-clinical, to make sure that they're on the right track as far as getting the outcome they want for their own patients. So, long story short, two ways you can do that collaborative practice of collaborative work with other providers or other professionals outside of clinical is you can do it officially in writing, but here it only works with physicians and pharmacists, or you can do it unofficial, like having a trusted someone that you always reach to. Yeah.
Thank you
So
so
when you
much.
ever need a pharmacist, for instance, you can go ahead and just sign on my consulting, and I'll be your pharmacist and help you with any medication related question you come across.
It, well, consultation can be done virtually, right?
What is it?
Like to consult people from maybe Nigeria is done virtually, right? It can be done
Well,
virtually.
actually, with that, I only do it. Help. They have to be in the U.S. because yes, I
Is that my
know because a lot of the medications, like Panadol in Nigeria, we use paracetamol and Panadol, but here it's not. I don't. We don't have that. I think we have it in England. It's closely related to Tylenol, and where I work, actually, I have a lot of Spanish speaking people, and I have a lot of people that come from Spanish-speaking countries, and they always come and they come with the box of medication that they get from their country. And sometimes I remember like something like Gelusil, you know, that Panadol, stuff like that. So the things that are closely related to medication here, but they're not exactly the same. So I won't really be a fit for someone, right?
definitely? If I see anyone looking for a pharmacist that's in your area, I'll refer to them. Absolutely. I'm trying my best.
Absolutely.
So,
Yes.
tell me, Dr. Freeman, you've been an amazing guest speaker thus far. Before we wrap up the session, what are your last words for the audience? Session.
Well, last word for my audience. First, I want to say thank you for having me. It's been a pleasure, and it's been fun trying to put together how we practice here and how it is in Nigeria. And for the audience, a lot of times, I mean, the platforms still this, it stays the same no matter where. Healthcare is always the same, and always remember at the end of the day, we're all humans and we're dealing with human life. So no matter what the geographical location is, or where the geographic location is, we're still on the same platform as in human health care, and being able to reach out to someone for assistance or for insights or for help on things that are outside your own scope or outside of what you can control or what you understand. Do not ever hesitate to do that. And if that person is me, you know where to reach me. I'm always on LinkedIn, or at least I try to be. Just send me a message. I'll leave my contact information below.
All right. Thank you so much, Freeman. We've come to the end of the session. So if you love this content, do to like, subscribe, and share to your network. Hopefully, someone in your
Absolutely.
network will really adore this video. Thank you, Dr. Freeman. Thank you, everyone.
Thank you. Bye.